Namaste. My name is Carl Rogers, and I work in the Public Affairs section of the United States Embassy here in Kathmandu, Nepal. The Fulbright program is the United States' flagship international academic exchange program, and since 1946, Fulbright has fostered mutual understanding between the United States and other countries. This year, the Fulbright program marks its 75th anniversary, with alumni serving as leaders in government, the sciences, business, philanthropy, the arts, and education. I also want to wish the Fulbright Commission in Nepal a very happy 60th birthday. Since 1961, Fulbright Nepal has been instrumental in bringing the United States and Nepal closer together. More than 1,300 United States and Nepali students, scholars, and researchers have been sponsored by Fulbright. But no matter what kind of project they complete or where, we hear the same response, that Fulbright is life-changing, and it has a profound influence on their professional lives and the communities that they work with. Fulbright alumni at their very core are leaders. And while this past year has been challenging, the COVID-19 pandemic has not deterred Fulbrighters' determination and spirit. Fulbrighters are pioneering research in the best of the United States and Nepali institutions. They are serving on the front lines as doctors and advocates, setting up clinics, drafting public health policy, and finding innovative solutions to help our communities stay safe. They're using the connections and the experiences and the relationships built during their Fulbright exchange to help inform them and respond to COVID-19 and to improve lives. Recently, Fulbright gathered together a group of alumni to discuss response efforts during COVID-19's second wave here in Nepal. And no surprise, Fulbrighters were thoughtful, proactive, and innovative in their responses. So I want to take a moment and just highlight a few of these alumni and celebrate their incredible efforts. Thanks to Biraj Karmacharya, who has been in close contact with colleagues at the University of Washington, where he did his Fulbright exchange, in order to help bring cutting-edge analysis and real-life skills to frontline responders here in Nepal.
Namaste. I'm from Dhulikhel Hospital, Kathmandu University School of Medical Sciences, and I'll briefly highlight upon our experience in terms of engaging the stakeholders. At Dhulikhel Hospital, Kathmandu University Hospital, we attempted to take the leadership role in waging a comprehensive fight against COVID-19. So we did not limit ourselves in just focusing around handling the COVID-19 patients in the hospital. We wanted to go a little bit beyond that. So from the very beginning, we tried to identify the people, the stakeholders who could be brought on board, in various ways, and get them involved in various capacities. In the first wave, to set up the triage, and even to set up an isolated isolation center within our premises, we worked exclusively with Army, and they helped set up our triage and a lot of other things in partnership with our team members. We worked with Kathmandu University School of Science, and we used their lab, their manpower, and we collaborated with them in producing and also ensuring quality of our own sanitizer and disinfectants. In the second wave, when we had terrible crisis of oxygen, it was probably one of the worst days of my professional life. So during those times, what we did was we worked with our School of Engineering at Kathmandu University and we collaborated with them in terms of optimizing the functioning of our oxygen plants that were existent at Dhulikhel Hospital. In the same way, from day one, we collaborated extensively with the local municipality, the local wards, the local health authorities in terms of testing, contact tracing, and also devising public health strategies to communicate to the local communities. We have been working from day one very closely with them. Even now, in the second wave, there's a huge outcry that the testing in the communities is really low. What we have been doing, in the second wave is working with the local communities and local health authorities in terms of expanding the testing to the rural communities as well. We've been working with private sector, for example, with the telecom companies. For example, we worked with Ncell in creating a national level hotline where the patients who are tested positive can get advice and can be followed up, till they are fine or till they need a referral. We've also been working with some business sectors in generating some resources. And in the same way, we've also been closely working with philanthropic organizations, embassies, Rotary clubs, Lions Club, and many other these organizations, for gathering whatever support we could garner from them. In the same way, we've also been collaborating internationally to philanthropic foundations, universities, and also other organizations, in supporting us in various ways. We have also been working very closely with the government in developing specific policies, plans, and also protocols. We've also been working extensively with media, various media groups, in crafting the right messages for the public and in disseminating the messages to a wider audience.
These four are only a few of the many Fulbright stories that we could highlight to illustrate the concrete contributions that the Fulbright program has brought to Nepal in our 60-year history. Happy 75th anniversary, Fulbright.